Hello, welcome to part 51 of Clinical Physiotherapy MCQ series. Here we go and discuss day-to-day clinical scenario with detailed explanation. Now don't waste our time, let's move to question number 251. A 70-year-old female patient reports the onset of mid-back pain after working in a garden for several hours. The patient reports constant pain, which increases with deep breathing, and demonstrates limited thoracic spine active range of motion in all planes. The patient has a 40-year history of smoking and long-term use of prednisone, deltazone. Based on this history, which of the following pathologies is most likely the cause of the patient's back pain? Option A, thoracic compression fracture. Option B, lung cancer. Option C, coronary artery disease. Option D, abdominal aortic aneurysm. And the answer is Option A, thoracic compression fracture. Explanation for this question is, the data in the question are risk factors for osteoporosis and possible compression fracture. This patient could have weak bones due to long-term steroid use, smoking, or being postmenopausal. Although lung cancer may be likely with a history of smoking, lung cancer is unlikely because of symptom onset occurred after prolonged flexion, and lung cancer should not cause limited active range of motion. Coronary artery disease and an abdominal aortic aneurysm would not cause limited active range of motion or pain with deep breathing. The patient's history does not increase her likelihood for having an abdominal aortic aneurysm. Now let's move to question number 252. A 92-year-old woman presents with hot, red, and edematous skin over the shins of both lower extremities. She also has a mild fever. The most likely cause of her symptoms is Option A, cellulitis. Option B, dermatitis. Option C, herpes simplex infection. Option D, Scleroderma. And the answer is Option A, cellulitis. Explanation for this question is, cellulitis is an inflammation of the cellular or connective tissue in or close to the skin. It is characterized by skin that is hot red, and edematous. Fever is a common finding. Dermatitis produces red, weeping, crusted skin lesions, but is not commonly accompanied by fever. Location on shins makes herpes an unlikely choice, and there are no skin eruptions or vesicles. Scleroderma is a collagen disease producing tight, drawn skin. Now let's move question number 253. A patient has just undergone a total hip replacement via a posterior surgical approach. Which of the following combinations of movements of the hip are most important to avoid? Option A, extension, medial rotation, and abduction. Option B, extension, external rotation, and adduction. Option C, flexion, medial rotation, and adduction. Option D, flexion, external rotation, and abduction. And the answer is Option C, flexion, medial rotation, and adduction. Explanation for this question is, these are the standard precautions to avoid dislocation with a THA that used a posterior surgical approach. Now let's move to question number 254. In the early management of a patient with a partial peripheral nerve injury, the goal of the physical therapy intervention will most likely be to prevent Option A, nerve degeneration. Option B, spasticity and increased muscle tone. Option C, muscle atrophy. Option D, contractures and adhesions. And the answer is Option D, contractures and adhesions. Explanation for this question is, the primary physical therapy goal in this case would be joint protection and the prevention of contractures and adhesions, usually through splinting. There is no evidence to suggest that physical therapy can prevent nerve degeneration and muscle atrophy, as they are the normal effects of a peripheral nerve lesion. Spasticity would not be present in a lower motor neuron injury. Now let's move to question number 255. A physical therapist is treating a patient with cervical pain. The patient reports that the pain occurs with most movements and feels stiff, with active range of motion. What is the most appropriate course of action? Option A, refer to primary care physician for further testing. Option B, initiate thoracic spine thrust manipulation. Option C. Instruct the patient on cervical spine stabilization exercises and issue a home exercise program. Option D. Initiate an upper extremity exercise routine to improve scapular and cervical range of motion and progress as tolerated. And the answer is Option B. Initiate thoracic spine thrust manipulation. Explanation for this question is, Option B, this is the most appropriate action. Increasing amounts of literature suggest that for hypomobility of the neck, thrust manipulation of the thoracic spine can provide short-term improvements in patients with mechanical neck pain, while Option A, this is not appropriate as there are no red flags mentioned in the question, and Option C, the cervical spine is stiff and needs more mobility, not necessarily more stabilization, although postural activities could also benefit the patient. Of the choices presented, this is not the most appropriate, and Option D, this is not the most appropriate initial action. So, that's all for today. If you have any doubts, please comment below. I think you have learned something valuable today. See you on the next part, that's part 52. See you till then, bye bye.